and everything. So I get like
Yeah.
a background.
Yes. Yes. So we are an IT services organization, Dr. Rashmi, and we've been in the industry for more than 15 years now.
Mm-hmm.
If you talk about the age groups, we have varied age groups. So we have recently joined interns, right, starting from that age group to people
Okay.
who are like 40 plus. So between 40
Okay.
to 50 age group.
Okay.
Maximum would be between 40 to 40, 40 to 50.
Okay.
That would be the upper cap. Other than that, mostly, if you ask me, people will be below 40. That will be the major crowd that we will have to take.
Okay. So 30s to 40s is what I'm getting would
Yes,
be a chunk
and
of it.
then we have people fresh out of college, so interns and the trainees as well.
So all the age groups then I think,
Yes,
as that.
absolutely. Yes,
Okay, got
correct.
it.
So, right, starting from 20 to 23 to say 45 plus.
Great, great, great. So, okay,
Yeah.
so let's begin. So, as you rightly said, we are all now working women in this century, and we do sort of handle a lot of roles in our life, right? We are somebody's daughter, we are somebody's partner, we are somebody's mother, etc., etc. So, a lot of roles, and at the same time, we are managing those roles, we are multitasking. We are working in the house, we are working outside, we are making money, we are climbing the career ladders. So we are trying to do all these things in our life, and each one of us is trying very hard to do well in each of the sectors. So but what happens is, when we are trying to do all this time, very little time is left for us to look after our own health. And sometimes, we don't go visit our doctors even though something is happening to us. We take it in our stride, कि नहीं होता है चलता है type of mentality. We don't pay attention to the kind of nutrition we are getting, the kind of exercise we are getting, the kind of sleep we are getting. And most times we've realized in our 20s and 30s, your body may not give you the signals needed for you to slow down. But when your 40s start hitting, when your 50s start hitting, and your body tells you, can, yeah, you've been doing it injustice. And, most of the times after 40s is when we really realize that, oh, something is wrong with my body. And then you may visit your doctor, and then you get a diagnosis, and then you work on it. The primary message from today's session, if I can give you, is prevention is the best cure. So your health actually starts in your 20s and 30s, right? The focus on your health should start way early in your life, rather than going to a doctor at 40 and 50 and then getting treated, right? So that's the first message I would like to give you today. And with that, let's begin our session. So today we'll be talking about different menstrual disorders, your genital hygiene, thyroid, breast, cervical care, a little bit about infertility, and little bit tips here and there about healthy living. So that would be the overall flow of today's session. When it comes to menstrual disorders, right? We see so many women in the clinic coming to us and telling us, that we have irregular menses. Our menses are too small in the number of days, or your menses are too big, you're bleeding for 7, 9 days. So I think it's really important to cover what is normal first and what is abnormal. Only if you know what is normal will you understand if you are in the abnormal category of it or not. So, when to seek help regarding your menstrual cycle is something I would like to cover first, right? So, we'll be covering a few questions. Let's start with the first. What is the cycle length? What is the normal cycle length that you should have in your menses, right? And the answer to that is around 25 to 35 days. If your cycle length is less than 21 days, you should definitely seek help. There is some underlying pathology that something has not been picked up. If your cycle length is more than 35 to 37 days, again, something is definitely wrong there. You need to go to your doctor, you need to visit your doctor and tell your doctor that this is happening. Is there anything underlying that needs to be checked, right? Now, there are two types of pattern. One is a regular cycle and one is an irregular cycle. Suppose you have a 35-day cycle, and but that cycle is regularly at 35 days you are having your periods. Again, not too much of an issue. But suppose once your cycle is 35, the next month it is 21 days, the next month to that 45 days, then you're definitely something is wrong underneath. You're not ovulating as you should be. Your hormones are not as in sync as they should be. So definitely, again, if this is your pattern, you need to get it checked, right? Overall, throughout the year, if you're not bleeding for more than 8 times, all right, there is again some underlying, that is, your cycle is way too stretched. You're probably bleeding once in 45 days or something like that. So this is the cutoff that we take. 8 cycles per year, you must bleed. Otherwise, there's some issue that needs to be checked. Coming to the next point, what is the cycle duration? You should ideally bleed somewhere between 3 days and 5 days. Okay, so we see so many times people come to us that, oh, doctor, my menses are only for 3 days. So 3 days is absolutely normal. All right. 5 days is also absolutely normal. If you're bleeding on the 6th day, as much as you bleed on your, let's say, second or third day, that is a bigger cycle then. Okay, that needs to be checked. Why are you bleeding on the 5th, 6th, 7th, 8th day? But if you're just spotting after 5 days, that's again normal, right? Even spotting is counted as periods if on time. So make sure you count your spotting days as well, right? And the most important thing I'd like to tell you is that if you're bleeding in between your menses, okay, suppose your menses come on 1st of March and the next menses is due on 1st of April, and suppose by 15th and 16th you spot in the middle, that is abnormal. That needs to be checked. Okay, we see so many times you've been spotting and you don't go to your doctor, you don't get it checked, and I'll tell you the repercussions of that later on. But if you are intermenstrually spotting, that's the term we call it, you must get it checked, right? How much is the flow now? This is a parameter that's a little difficult to measure. On an average, we say if you are changing more than 4 to 5 pads in a day, that we quantify as a little heavier flow, and less than 2 pads in a day, that is less flow. So this is just a generic kind of guideline. As I said, it is very difficult to quantify the flow as such. It's not something that we take and measure. So it is individualized. Some people will be on the lower spectrum of flow, whereas others will be on the higher side. But just as a generic guideline, less than 2 pads a day, a little bit of a problem, and more than 4 to 5 pads rather a day, little bit of an issue. All right, so you can get that checked. Next is, what is heavy flow? Now, you are supposed to bleed fresh blood. I think this is one concept that, so many people don't get, that you are supposed to bleed fresh blood. If you're not, if what you are getting out is only clots, that is abnormal. You need to get it checked. And by that, I mean that suppose there is most of the times fresh blood and suppose 1 or 2 clots, that is normal. That's fine. Clots coming out in your menstrual blood are a normal part of your menses, but those are not the only things that should come out, right? You should not be getting out only clots. That is what is abnormal, right? When it comes to your menses, a generic guideline is any change in pattern, if it lasts for more than 2 months, it's abnormal. By that I mean, suppose your periods are around 35-day cycle. Okay, I'll call that normal. Regularly you're bleeding for 35 days, and suppose you just suddenly start bleeding for bleeding after 20 days, and that becomes your next routine, next regular thing, that is normal, because that is constitutes as a change in your pattern. So anytime you get a change in pattern, you need to go visit your doctor so he or she can get a hormonal profile done. See if there's any underlying change in your body. See if then you're going through any sort of lifestyle change, lifestyle disorder, everything like that, right? So any change in pattern, you need to get it checked. We all know about PMS, it is premenstrual syndrome. Up to some degree, we'll quantify this as normal. For example, you're getting cramps before your periods, you're getting mood swings, you're getting irritability, you are getting breast tenderness, bloating sensation. All of this is normal. When does it start to become abnormal? When it interferes with your normal work life, right? You shouldn't say that, oh, I'm having PMS and I am missing my work days, or I'm missing some social event, or I'm missing, you're absolutely lying in bed because you're PMSing. That sort of degree of PMS happens to some women, and I'll quantify it as abnormal. I'll also say that you of course need to go to your doctor and get it checked, because do not take that in your stride. Do not label it as, oh, it's just PMS, hota hai, chalega, I'll manage somehow. Don't do that. PMS, even though it's a normal part of most women's life, it should not interfere in your work life, right? So that's one thing about PMS. We do get other symptoms: pain, sort of fatigue, malaise, irritability. And again, the same thing, up to some extent, all these are normal. Beyond an extent that it impacts your life in a certain severe way, please get it checked. Please go visit your doctor. Moving on to the next factor, PCOS, and this is a term that has been thrown out into the world in the last decade. You know, we have seen a rise of PCOS cases, and most people, I believe, do not understand what PCOS is, right? And the first sort of message I want to give you about PCOS is that whether you are obese or whether you come in the lean category, PCOS can hit both these categories, right? Uh, if you're overweight, doesn't mean you will be PCOS. That's the second message. If you have PCOS, doesn't mean that you will be obese. You can be lean and still have PCOS. All right. So the first thing to get out of your mind, it's a myth that only because you're overweight you have PCOD. Right. PCOS is a less severe form. PCOD, or the polycystic ovarian disorder, as we like to call it, is a more severe syndromic form. Right. How do we diagnose PCOS, right? First diagnosis is by a sonography. And you can see on your screen, I've put a picture of two ovaries, and you can see some small eggs, the black ones, and these increase in number. These, if I find in your ovary 17, 18, 19 eggs per ovary, I'm going to call that ovary crowded, and I'm going to label you PCOS. The second way we diagnose PCOS is through your hormonal profile. If your testosterone levels have risen, if your luteinizing hormone levels have risen, if your AMH is high, I'm going to label you as PCOD. Yeah. So that's the way we diagnose PCOS. And what are the different symptoms that you'll have? Now, pay attention to these symptoms, because you can pick up these symptoms at home and you can go to your doctor and say, Doctor, do I have PCOD? Please get me checked, right? So, thinning of scalp hair can happen because of increase in testosterone. You may be at a higher risk of BP, hypertension, and sugar, right? You may have an acne outburst. You may have dark patches on your skin, and mostly two areas. One is underarm, and second is the nape of your neck, behind your neck, right? A sudden amount of weight gain, okay? Sudden spurt of facial and bodily hair growth, what we call as a male type of pattern of hair growth, that you may have. Suddenly your periods may get irregular. A sudden onset of absence, absolutely 4 months of no menses. If you have any of these symptoms that I've mentioned, go surely visit your doctor and get it checked, right? It's important to know what can happen so that you can pick it up yourselves, right? So this is just the same slide: hirsutism, the underarm sort of blackening, male type of hair growth, acne, and baldness may set in. So identify these factors if they are happening with you. Coming to the next topic, and that is a very important topic of genital hygiene, right? Now, our genital hygiene, why by that I mean two things. One is the outside area, or the perineal area, or the vulval area, and the second is the internal vaginal area, right? So now we have a very beautiful mechanism at the end of our vagina, that it's a self-cleaning sort of pathway. You see that discharge that keeps coming out of your vagina, that is the way your vagina is cleaning itself, right? Now, when does it become problematic? If your discharge is so much that you're wetting your innerwear constantly, if your discharge is foul smelling, if your discharge is yellow or green or red, and if because of your discharge you're getting itching, any of these things happen, and you know that you may have a vaginal infection going on, right? So go visit your doctor. But otherwise, discharge is normal. We see so many patients coming to us and saying, "Nahi, doctor, discharge ho raha hai, kuch to karo." And we ask them these four questions: Is your discharge bothering you in any way? And they're like, "No, it's not bothering." So we're like, "Well, then why are you coming?" You know, it's the way your vagina cleans itself, right? And so your vagina is acidic in nature. So what it does is, it by default kills the bacteria that it comes into contact with, right? The only bacteria that survive in the vagina naturally is the lactobacilli, which is also found in your gut. You must have heard of the gut microbiome. So that way, we also have a vaginal microbiome down there, right? And that is what also keeps our vaginal microbiome healthy, right? So we have these mechanisms in place, and we don't need to go disturbing them unnecessarily. Right now, a simple way to maintain your vaginal hygiene is uh, pee before you have sexual intercourse and after you have sexual intercourse, because that's the best way to flush it out, right? um, Personal hygiene, especially during menstruation, make sure you're having baths, don't skip them. Make sure you're using loose cotton innerwear because you need your areas well ventilated. Make sure you're either just cleaning your outside area with warm water, not too hot water, not too cold water. uh, Soap, if you want to use, sure enough, a little bit here and there, but not too much again, right? When it comes to your menstrual hygiene, another very important factor is making sure of your pad hygiene. So make sure you're using cotton pads, right? The commercial pads that are available in the market are all using a lot of chemicals. They may cause you skin rashes, skin itching. They also don't ventilate the area as much, right? So causes a lot of incubation kind of atmosphere for the bad bacterial growth. So you get sort of recurrent vaginal or urinary tract infections. Your pad also needs to be changed every 4 to 5 hours, right? Do not keep your pad for more than 6 hours because, again, blood is one of the best incubators for bacteria, right? The blood that has come out on your pad is like a very good incubator mechanism. So make sure you're changing it often, okay? So that was about your pad hygiene. Vaginal washes, are they necessary? So as I've already mentioned, your vagina is a self-cleaning mechanism to it. So no, technically you do not need these pH balances because as I told you, your vaginal pH is acidic by nature and it needs to be maintained in that acidity. No putting your fingers in and cleaning, no putting soap in, no putting any vaginal douches in. You do not need all these sort of washes at all. Just lukewarm water will do the trick. Pubic area hygiene, keep it trim, especially in the summer months. So that's another tip. Okay, coming to the next topic, cervical cancer screening. This is one of the topics that I find most women in India are not very well versed with. They don't know when to start screening. They don't know the kind of risk factors that are involved. What can predispose you to futuristic cervical cancer is something that we need to keep in our mind. And the awareness needs to start at a very young age. ऐसा नहीं है कि after 40 I'll start, oh, now I'll start thinking about my cervical cancer. You need to start right at a very early age, right? So what will predispose you for cervical cancer? Multiple sexual partners. One of the most common factor to get cervical cancer is this. Age at first intercourse. If your age is less than 18 years, again, you have a predisposition towards cervical cancer. Multiple full term pregnancies, and by that I mean like 4 or 5 full term. We don't see that much nowadays in this population, so that's fine. Any history of sexually transmitted disease, any chlamydial infections, any gonorrheal infections, any herpes infections in your vagina, that will predispose you to cervical cancer. History of smoking, very important. If you're smoking, you need to be very alert about cervical cancer. If you've been using oral contraceptive pills for more than 5 years, again, be very alert about this. Any family history, any direct relative with cervical cancer, your risk increases for it. Any history of immunosuppression, for example, if you've been on long term steroids or you are seropositive, right? Again, you are predisposed for cervical cancer. And in general, a lower socioeconomic strata is more predisposed, and by race, blacks and Hispanics are more predisposed. So you need to know whether you're falling into any of these categories so as to be more alert in your life, right? What do we do? How do we check if you have cervical cancer? And the most easy screening method is a pap smear. And what we are going to do is put up a speculum in your vagina and just take a smear. Watch that smear under the microscope and see if there are any inflammatory cells or not, if there are any cancerous cells or not. Right? It's a very easy step. most women I find are very scared of a pap smear, and they come very anxious that, oh, we want to get a pap smear done. It does not have to pain as much. We use a lot of lubricants, and no, there is no long lasting pain. There's just an acute sensation of something going into your vagina. Other than that, there's no pain. So do not be anxious of getting a pap smear done. The second test that we like to do these days is an HPV, or the human papilloma virus test. HPV is known to cause cervical cancer. It's known to sit in the rugose of your cervix and vagina and cause long-term cancer. So HPV testing, again, very important, right? Now, what are the generic guidelines? And check which age category are you following in, and go by the recommendations by that age category, right? So less than 21 years, screening not recommended. 21 to 29 years, right? A pap test every 3 years you're supposed to get. Okay. If you are in the major chunk of the population, that is from 30 to 65 years, you need to get a pap smear done and an HPV testing done every 5 years, or pap every 3 years, right? And if you are above 65 and you don't have any risk factor, then you're in the low risk category. Screening may not be recommended. Again, if you are hysterectomy, your uterus has been removed, screening is not recommended. All right. And women who have received HPV vaccine, again, just routine screening every 3 years is good enough. About HPV vaccine, we have two vaccines in the market. We have the Cervarix and the Gardasil. Both are beautiful. Both work very, very well. We have different 14 different HPV strains that are covered. The thing to remember about HPV is, suppose you do have HPV infection, you've been diagnosed, right? Usually HPV strikes you in one strain. You will still not be immune to the other 13 strains out there. So you still may need an HPV vaccine. So that's the message I want to give you. Just because you've had HPV does not mean you do not vaccinate yourself. It's always a good idea to take the vaccines, right? Both vaccines are equally efficacious. You can choose either one, right? And what are the safety results? They are well tolerated vaccines, and you may just have injection site pain, redness, or swelling. That's about it. That's true with any vaccine you take. Okay, so that was about cervical cancer. Moving on to breast cancer. Again, a very, very important sort of screening that you need to do, because these cancers are best treated if they are caught early. You don't want them to grow, and then you go to the doctor at a late stage, and then your life expectancy sort of reduces quite remarkably. Whereas if they are caught on early and you do get the right treatment, then the probability of having a longer, healthier life goes up remarkably. So why not? I mean, you need to do some simple tests. One is self breast examination, and I'll run you through it, how we do it. And second is mammography. So breast examination, what, how, when, and why. So this statistics is quite staggering. 40% of women are diagnosed with cancer, breast cancer, because they first felt a lump. So such a huge chunk of breast cancer can be caught only because you decided to do a breast examination at home, right? So how do you go by it? You are supposed to do it in two ways. One, standing in front of the mirror, and second, lying down in your bed, right? So it's simple, it's non-invasive. Just stand in front of the mirror, put your hand up behind your head, and with the other hand start palpating your breast. And you can actually go clockwise. So start at 12 o'clock, go to 3 o'clock. So the area between 12 to 3, check first. Then the area between 3 to 6, then between 6 to 9, and 9 to 12. What are you trying to see when you are doing your breast examination? One, is there any lump? Second, is there any pain on squeezing that part of the breast? Okay. Third, if there is a lump, is that lump attached anywhere, or if is it running around in your breast? Is it mobile? Right? Fourth, if you do have pain or if you do have lump, how is the skin on top of that area? Sometimes when you do have a lump, you may find changes on your skin. So basically, your skin may become pitted like an orange skin, or your skin may become red, or your skin may itch. And the last important step of the breast examination is squeeze your nipple and see if there is any fluid coming out, if there is pus, if there is watery discharge, if there is blood, All these are alert signs to go to your doctor and get your breast checked. The same sort of breast examination you also need to do while lying down, because there are things you may catch lying down that you may not catch standing up. So both ways, do your breast examination, right? The second is mammography. That's simply an x-ray of the breast. Very important to do again, especially if on breast examination you have any doubt, go for a mammography, right? And again, what are the guidelines? If you're above 20 years, self breast examination monthly, right? If you're above 40 years, mammography annually. And if you're in the high risk, suppose you have fibroadenoma, or suppose you had a previous breast tumor which has been removed, or you've been biopsied, then annually mammography and MRI, both, because you lie in the high risk category, right? So that was about your breast examination. Next, coming to infertility, of course, my favorite topic to discuss. Let's first see what is infertility, right? So, if you and your partner have been trying to conceive without protection for more than a year, you've been keeping regular intercourse, and you've not conceived in a year, then and then only you've the label of being infertile is given over there, right? What is primary infertility? If you have never conceived before, that is primary. And what is secondary? If you have conceived before, but now you've been trying for 1 year and you still can't conceive after regular unprotected intercourse, that is secondary infertility, right? What are the stats? And the stats are again quite staggering. We have seen a steep incline in the couples coming to us with fertility issues. So one in every six couple will face some sort of fertility issue and will need some sort of aid to get pregnant, right? These are the same statistics as people who have a stroke, people who have experienced depression, men diagnosed with prostate cancer. So that's how common now this has become. Again, in the general population, we see around 7 to 10% of population, and this figure is rising, who are infertile. Out of this, we see one third coming with male issues, one third coming with female issues, and the other one third, the last one third, is when they both have combined issues, right? So it's no more a problem of only women. It's no more only women's side, right? We have an equal amount of male infertility cases that is popping in. They go hand in hand rather. So the thing to remember is, whenever you go for any fertility counseling, always take your partner along. Never say कि मैं मेरी पहले चेकअप करूंगी, उसके बाद I will take my partner and let's see if anything comes up with him. Get your partner on board for fertility treatments. Make sure both of you are coming to a couple as a couple to us, and then starting your treatment, getting your test done at the same point of time. Because unnecessarily what happens is, we do all the battery of tests on you, then we realize, oh, though there is no issue, and then we call your partner, and then we start finding out what his issues are, and then we take more time fixing his issues, if any, and then by the time you're already desperate for a child, and many months roll by like this. So make sure when you're coming to us, you both come together, because it's a 50-50% issues now. Also, what are some of the lifestyle factors that are happening, right? We are facing a lot of work pressure. We are facing constant radiation. We are using pesticides in our food. We are using chemical food additives. We are using coloring agents, all of which is impacting our fertility. Lack of exercise, sedentary work, a lot of pollutants, carbon monoxide poisoning. If you're smoking, that adds to the risk. If you're alcohol, that adds to the risk. Any unhealthy lifestyle, uh, disordered sleeping patterns, all of it will contribute to your infertility. So some of the lifestyle causes of female infertility I've already mentioned. Age, the moment you go beyond 35, there's a steep decline in infertility, and I'll cover that in the next slide. Smoking will cause loss of your eggs, all right? Your follicles literally die due to smoking cyanide and other toxic chemicals in your body. Alcohol and recreational drugs will impact your fertility. Excess of body weight, obesity has a direct linkage to infertility. And too much coffee, anything more than 2 cups of coffee in a day, you're predisposing yourself to a little bit of an infertility, right? So what are the effects of age? You can see the sort of statistics. When you're born with 7 into 10 raised to 6 follicles, right? Lots of follicles. By puberty, they have already reduced to around 3 lakh. And by menopause, you have less than 1,000. So that is the rate of dying of your follicle de facto. So no matter what you do, this loss is going to happen. And overall, you'll ovulate only about 400 to 500 times in your life. So those are the only eggs that you can actually use, despite having been born with lakhs and lakhs of eggs. They are actually of no use like that directly. You can see in this graph fertility rate by age. So the pink line is the women's line, and can you see once you go beyond 30, what we've heard this are sort of family members or relatives talking that your biological clock is ticking, and we don't give much attention to it. But if you see the statistically, it's true. Once you go beyond 30, by the time you come to 35, your fertility is already dipped. By the time you go to 40, it's always almost crashing down, right? And if you see the blue line, when it comes to men, they are the luckier in this way, because their fertility starts to dip after about 45 years only, right? So a lot of difference between a male and a female when it comes to fertility. So we as women need to be more aware, more alert that our fertility is dipping faster. You can also see fertility by age. So the red dots is where the infertility is starting, right? So can you see after 30, there's a small uptick, and on 35 to 39, there's a big uptick when you come to 40. So that is how much your fertility problems are growing when you are aging, right? So age by default is a very important factor. The second factor that will massively affect your fertility is the effect of weight that you carry. And weight, by default doesn't only affect your fertility, but it's going to affect a lot of other parameters. You are going to be an increased risk of stroke, increased risk of myocardial infarction, increased risk of menopause, increased risk of osteoporosis, sleeping disorders. So a lot of issues with weight, right? Fertility is just one of them. Another important term I'd like to discuss is premature ovarian failure. Now, what does this mean? If you are below 35 years of age and your menopause has started, okay, suppose you're not been bleeding for like 4 to 6 months, and you go to your doctor, and your doctor runs a hormonal profile on you, does your sonography, and tells you we can't see any eggs in your ovary. That means you have hit premature ovarian failure. Two things that come out of this: one is obviously fertility problems. If you don't have any eggs, you can't be fertile. And secondly, menopause is going to hit you early. So all the drawbacks of menopause that a lady will see in her 40s and 50s, you're going to see in your 30s. So you also need to be aware of this sort of system. So if you don't have periods for 4 months, do go to your doctor and do get this checked as well. Some other symptoms that you need to be aware of: any pain during your menstrual cycle, or even uh, during your menses, or during your cycle in general. You need to get two things checked. One is endometriosis. What does this mean? The menstrual lining that is supposed to come out during your menses has actually gone retrograde, and it has gone into your abdomen. So there is actual menstrual deposits on the outer side of your ovaries, on the outer side of your fallopian tubes, on the outer side of your uterus, or anywhere in the abdomen, right? Now, what this does is extreme pain, pain during intercourse, pain during your menses. What this does also is it distorts the anatomy because organs start sticking to each other. So, a lot of cramps. So, endometriosis is something that will present with infertility, it will present with pain. So, you need to get this checked if you have these symptoms. The second symptom, if you have any pain, is fibroids. Now, fibroids are benign growths. Fibroids can grow inside your endometrial cavity. It can grow inside your uterus, right? So you need to get it checked. Some of the fibroids will affect your fertility. If your fibroid is growing inside the cavity, can you see I've marked it in a black window? We also like to call this a polyp. If this polyp is distorting your uterine cavity, you may have trouble falling pregnant. So best that this is removed. So that was about that. Now, wherever in the world you go, you've got three treatments when it comes to fertility. One is ovulation monitoring. We are seeing whether your egg is growing or not, whether your egg is rupturing or not, what we like to call as ovulation. And then we are telling you, now you keep relations. This is a good time to be pregnant, right? That is the first step. If you don't fall pregnant with that, we go to the second step, and that is IUI, or intrauterine insemination. And what we are doing is, again, we are growing your egg, we are rupturing your egg. When your egg is ruptured, we collect the sperms from your partner, we wash them, and only the good sperms, we put a tube into your uterus, and we leave the sperms inside your uterus so they can go and meet the egg. And the fourth is IVF. Okay, the third is IVF. So what do we do in IVF? First is we want to grow your eggs. So number one is ovarian stimulation hormone therapy. Number two is we want to do a ovum pickup procedure or an egg pickup procedure. This is done under anesthesia. We are literally sucking the eggs out of your body. These eggs are going into a lab. We are preparing sperms, and we are taking the sperms, and with one egg we are mixing one sperm. So we are forming embryos outside in the lab. So fifth is embryo development in the lab, and the sixth is the procedure of embryo transfer. We are grading your embryos, and then we are one by one transferring the embryos into your uterus for them to implant, right? So that was about your infertility treatments. And coming to the last session, that is tips for healthy living, I started the presentation by saying that we are multitaskers. We take on a lot of roles in our society. We are a sister, a wife, a mother, a friend. We are career women, and what we have to manage in the end is our work life balance, right? You need to give time to every little thing, but in this, you do not and cannot forget your health. You cannot take it in your stride and say, we'll see. And we all suffer from something we call as a superwoman syndrome. We are constantly multitasking right from the moment where we get up to we sleep. We are handling home, we are handling work, we are handling social life, a lot of things, right? In between that, let's not forget to take some time for our health. And the first thing is exercise. The thing that will impact your life the most is your muscle strength, right? So more than cardio, more than anything else, your endurance, the muscle strength is something that will preserve your health in the long term. So make sure you are lifting weights. Make sure you're also working on your flexibility by doing some yoga asanas, right? Mix up your sort of work routine. Don't just stick to one. Some people just keep going to the gym for 6 days. Some people just do yoga asanas. Some people just like to run. But the point is, you need so many different types of exercises. You need cardio, you need yoga, you need gym, all of it. So make sure you're mixing and matching. Also make sure you're meditating so that your mind health is good. Avoid taking your screens to your bed. Make sure you're sleeping pattern is the same. Suppose you go to sleep by 11, fair enough, that's fine, as long as you're going to bed at 11 every night, of course. So that's one thing you need to keep in mind. Stay hydrated throughout the day, especially in the summer months. Make sure you're having a mixed healthy diet. So one important sort of message that my professor had given me, and he had told me, remember, whenever you eat out, think of it that is a part of entertainment. It's not food, it's just entertainment. Because no matter how much outside food you try and label it as healthy, the only healthy food that you're going to consume is something that you are making in your own homes. You are buying the groceries, you are washing the vegetables, you know the quality of ingredients that you are using, you know the amount of calories you want to consume, the kind of mixed diet that you want to have. So the only nutritious food you're actually having is the one you are cooking, or your maybe someone in your home is cooking, right? Outside food is just entertainment. So let's keep that in mind, and let's limit our outside food. And of course, this is a no-brainer. Say no to junk food as much as possible. We have a lot of food additives that is impacting your health now. A lot of sugars, a lot of salt, a lot of coloring agents, a lot of MSGs, a lot of citric acid that is being used. So everything that's packaged, again, not really food, right? You are eating it, but it's not really food. So, yep, that's about it. And self care is something that you need to take. on a serious note, um, self care. So we do take care of others in our life, but fill your cup first. Make sure you are okay first. We हो ना in the aeroplane की mask खुद पे पहले लगा लेने का, फिर बाद में सबका देखने का. So if your health goes down, you cannot be a good mother, you cannot be a good partner, you cannot be a good daughter, sister, because you yourself will be struggling. So how will you take care of others? So fill your own cup first. Make sure you're taking care of yourself, and then look after the rest of the world. So that's about it for today. If there are any questions, I would love to take them. Hello.
Yeah, Dr. Rashmi, thank you so much. It was a very informative session. I'm sure, as I said, we knew most of it, but you telling us and emphasizing the fact, I'm sure it's going to help us.
Right.
And if there are any questions, please feel free. You can unmute, you can put your questions in chat, and we can have Dr. Rashmi helping us out with the answers.
Hi, I would like to know more about HPV vaccination. Is there any age criteria? Can you explain it more detail? Like, what is the age criteria we can take, or is there any specific requirement?
Right. So,
Let's say, yeah.
usually, if you see in the Western world, what they recommend is that as soon as your daughters hit teens, early teens rather, you can start the vaccination. Why they are saying that is because in the Western world, the age at which the first intercourse happens is very young, right? In India, this age is a little bit more on the backside. So usually in India, we say that once you hit 16 to 18 is a good age to start vaccinating your daughters, right? Now, there is no upper age limit as such for HPV vaccination. Also, as I said, if you've been diagnosed with any of the sexually transmitted disease or with HPV itself, that is also not a contraindication to get a vaccine done. So, and especially if you have history of multiple sexual partners, again, a very, very important thing to get yourself vaccinated. So there's no age sort of limit for the vaccination, but usually in India, we say 16 to 18 years, you can vaccinate your daughter, and you can go up when, as long as you have not taken your uterus out, you can vaccinate yourself anytime. That's fine.
Is this a one-time vaccination?
There are, I think, three vaccines: 0, 4, and 8. So there are the three total vaccines. Different brands have sort of different vaccination schedule. So once you go to your doctor, depends on the brand he or she is using, Gardasil or Cervarix, and that way they'll vaccinate you on the schedule. Any more questions?
I have one doubt I wanted to ask regarding that because I heard a lot about menstrual cup instead of using pads, like being
Correct.
into eco-friendly terms we can call
Correct.
out. So I wanted to know how much menstrual cup like is it feasible to be used and what is the advantage like other than using that pads pollution wise if you talk about other
Mhm.
than that, what are the advantages of menstrual cup and how much we should use it like that? Is
Absolutely.
it safe enough? Yeah.
It's a beautiful device, as long as you're cleaning it well, right? So usually the timeline to sort of empty your cup, everybody has a different timeline. Some cups will fill in about 4 hours, some cups will fill in 6 hours, some cups will fill in 8 hours. So depends on your flow. Usually we see on the first 2 days, whenever you have heavy flow, the cup sort of fills in about 4 hours. So that is the timeline that you need to sort of wash your cup and reinsert it, right? Nowadays we also get cup sterilizers. You can go on Amazon and find, and
Yeah.
you can sterilize your cup and use it. It's absolutely a beautiful device, as long as you are sort of washing your cup and putting it back every 4 to 5 hours. So the same sort of timeline that we use the pads on is the same
Mm-hmm.
timeline that you need to, but just take care of the cup so that as to not introduce any infections, right? You don't want that side effect to come. So as long as you are sanitarily using it, taking care of it, it's an absolutely beautiful, beautiful device. And there's a sort of a learning curve with the cup, right? One or two cycles, you may find it a little uncomfortable. You may find sometimes you may spill because you are not emptying your cup on the time, but you'll get a judgment in about a couple of cycles. And after that, people are actually never go back to pads. So try using it by all means. It's great.
Surely. Thank you.
Yeah. Any other questions? I would love to answer if you have any queries about your reproductive health.
Also,
Ma'am, I
like
have
I
a
have heard, like after 30s, like women are majorly suggested, like, or after post pregnancy, it has been suggested, but like after 30s, majorly the women are suggested to go for calcium tablets maximum time. So is it like okay when your doctor says it, or like we can get start with our own? How you would put it?
So the only thing with calcium supplementation you have to take care is that you don't have any history of kidney stones, right?
Mm-hmm.
Sometimes you have calcium oxalate stones. Some people do have a tendency of forming. So if you have any sort of a family history of stones, or if you have had previous prior stones, then make sure you're contacting your doctor. Otherwise, what you're saying is right. Post 30s, you can take calcium by yourself. You can self medicate that much. That's fine. It won't really have any other side effects.
All right. Thank you.
Yeah. Also, we see in our Indian population, we are massively vitamin D deficient, right?
Hmm.
50% of people, their reports will come vitamin D deficiency. So, along with calcium, you make sure you're taking a little bit dose of vitamin D. It's very ironic because we get a lot of sunlight, but what is happening is we are not getting the sunlight that we need. What we need is from 6:30 to 7:38 wala sunlight, the very early sort of sun rays, and we are not exposed to that. And it doesn't matter if we go in the 12 o'clock noon sunlight, that's not going to make your vitamin D as such. So we are massively deficient in vitamin D. So make sure you're taking that as well.
And any update on protein powder? Shall we take or consume it on daily basis, protein powder?
That's only if you're doing
Because our daily life.
heavy
Yeah.
workouts, you're sort of doing massive heavy workouts. Otherwise, it's a little difficult to digest, even whey protein.
Yes.
So
Okay.
let's not generalize it and say everybody needs to take protein powder. Let's do it from a case to case basis. Also, even with protein powder, you do need to rule out whether you're having any sort of kidney issues, right? Because your kidney is something, liver and kidney are two things that are going to detoxify everything that you put in your system. So make sure you're not pressurizing your system that way.
Okay. Thank you.
Ma'am, I have one doubt.
Yeah.
Ma'am, before menstrual cycle, suppose we are getting brown discharge. So what
Mhm.
does it mean? Like, is it normal or something serious?
No, some people do have brownish discharge. Some people may have spotting for a couple of days and then their actual menses start. So, more or less, this is normal. As I said, if your period is irregular, absolutely, or if you're bleeding in 20 days, or if you're not bleeding for 45 days, then, but otherwise, the discharge here and there is normal. That's fine.
Okay.
Yeah.
Thank you, ma'am.
Anybody else? Okay. Shall we wrap up then?
Yeah, so thank you so much, Dr. Rashmi. Thank you once again. And if there are any more questions that we get from any of the members who've attended the training session, maybe I'll discuss it with you separately and we can come back to them with the answers.
Sure. Works.
Yeah.
Yeah.
Thank you
Thank
so
you.
much for your time.
Yeah.
Thank you everyone for attending the session. Have a great weekend. Bye.
Thank you.
Thank you.
Bye. Thanks.
Thank you. Bye.
Thank you.
Thanks.
Bye.
Bye.
Thank you.
Thank you, Dr. Rashmi.
Thank you.